So we've got the beginning of this presentation, and here you've got the X-ray. You've got AP, so you've got anteroposterior scan. You can see the parts, so you can see the body. You can see the body. You can see the arches, spinous process. Here you can see the intervertebral disc, and you've got scoliosis, of course, right? Here you've got the ribs. And here you've got the connections between the vertebrae. So you've got superior articular process, inferior articular process, okay? So we've got the superior view. So if you've got the superior view, here you can find the vertebral body. Here you've got the vertebral arch. Here you've got the vertebral foramen. Here you've got the transverse process. Here you've got the spinous process. Here you've got the superior articular process, inferior articular process. So we've got 7 processes. Okay. And here we've got the summary of the vertebrae. We've got cervical, thoracic, lumbar. And if you've got the body of the cervical, superior surface concave, inferior concave as well. But if you've got the superior, we've got this one concave in anteroposterior axis, inferior in this axis, so in the transverse axis, okay? Vertebral foramen large and triangular, transverse process with the transverse foramen. Transverse foramen, inside we've got the artery and we've got veins, 2 veins usually. So we've got vertebral vessels inside the transverse foramen. The anterior part is called the anterior tubercle. The posterior part is called the posterior tubercle. Okay, articular processes, we've got something like that. Here you've got the smooth surface, the palm of the head, supero posteriore. So posteriore, superiore. We've got something between supero posterior. Inferior facets, you've got like that. Here you've got the surface directed inferior anteriore. Here you've got anteriore. Here you've got inferior, we've got something between. Spinous process by feet, short. Here you've got C3, C5, usually C2, C6. C7 is called the vertebra prominence. Okay. In thoracic vertebrae, heart-shaped, 1 or 2 costal facets for articulation with the head of the rib. So if we've got the body, usually here, you've got the beginning, the attachment of the rib, okay? Vertebral foramen, circular and smaller. So circular, smaller. Transverse process, long and strong. Length diminishes to the thoracic vertebrae. Articular processes, superior facets directed posteriorly, inferior facets directed anteriorly. So we've got joint between them. Spinous process, long and slopes posterior, inferior. Okay. And lumbar vertebrae, lumbar vertebrae, the body, massive, kidney-shaped. When viewed superiorly, vertebral foramen triangular but small. Transverse process, long and slender. Accessory process on the posterior faces, somewhere here on the base. Articular processes, superior, directed medially, with the mammillary process on the posterior aspect of them. Inferior articular processes directed laterally. Spinous process, hatchet shaped, short and sturdy. Okay. And during the class, you had the trick. I tried to check you. So if you've got the C6 vertebra and you've got C7 vertebra, here you've got the transverse processes, and inside we've got the transverse processes. So from C7 you've got the veins. Okay, so from C7 we've got the veins, the vertebral veins, and from C6 you've got the artery with them. Okay. Okay, so if you've got C6 transverse foramen a little bit bigger, C6 a little bit smaller, okay? And the continuation of them, the continuation of the vertebral vessels, you've got on the C1. C1 is composed of anterior arch, posterior arch, lateral masses. Here you've got the lateral masses. And posteriorly here, on the posterior arch, superior aspect, we've got the place for the vessels. So here you've got the vertebral artery, here you've got the vertebral veins to enter the skull. And here you've got one suboccipital nerve, C1. This is the content of the vertebral groove. Okay, so be careful with the vertebral groove. Okay, and sacrum, inside sacral canal, sacral foramina dorsal ventral. The base is the name for the beginning, the apex for the end. Pelvic surface, dorsal surface, and 5 crests on the dorsal aspect. Here between intermediate and lateral, you've got the dorsal foramen. Sacral hiatus, sacral cornu at the end. The coccyx, this is rudimentary vertebrae. Okay. And it's the end. Thank you very much for your attention. See you soon.